This is our second work with Dana-Farber and the Gabriel lab, as well as the Getz lab at the Broad Institute, whereby we looked at clonal hematopoiesis in multiple myeloma. So our previous work was studying the effect of clonal hematopoiesis in patients with relatively newly diagnosed multiple myeloma, but starting from the time of autologous stem cell transplant. And the difference was in the previous study it was in a different treatment era for multiple myeloma. So it encompassed patients that were getting a stem cell transplant between 2003 and 2011, while now we're looking at a different patient population from a newer treatment era. And this basically comes from 2014, 2015 up until now. And we definitely see difference between the outcomes. So the previous paper, we looked at clonal hematopoiesis at time of transplant, and we saw that it was associated with worse progression-free survival and overall survival, specifically in those who did not get Revlimid as maintenance therapy after transplant. Now, as you probably know, Revlimid is becoming more and more, it is the standard of care for maintenance therapy after transplant, and it's definitely becoming more utilized compared to the previous treatment era. So a lot of the patients right now were on Revlimid as part of the therapy. So we actually, first of all, utilized a new methodology to identify clonal hematopoiesis, because with this new bioinformatic algorithm, we looked at both the tumor and the normal sample of patients, and we were able to identify or clear out mutations that could have been called as CHIP mutations or clonal hematopoiesis mutations, while they were in fact actually tumor mutations that were just contaminating the sample, or they could have been just germline mutations, which definitely shouldn't be considered clonal hematopoiesis. So that was the first step, and we were able to see that in around 10 to 11% of all these patients. And this was a lower number compared to what we saw before, and it could have been due to a number of reasons. But most notably would be the fact that we're now using this algorithm that really differentiates between clonal hematopoiesis and other mutations, or the fact that this is really at time of diagnosis, all these patients were treatment naive, while in the previous study they had already went through induction therapy before we looked at if they have CHIP or not. And in this population now, we saw that when you have clonal hematopoiesis, overall survival and progression-free survival were not really affected. But the thing is, the majority of these patients are on Revlimid, which is something that in the previous paper we saw that, when you're on Revlimid, the effect of CHIP on OS or PFS is obliterated, basically. So we think that that was the major thing that was affecting the overall survival and progression-free survival of these patients. But the other interesting thing we saw was that over time, and technically it was a short period of time of follow-up for around 50 patients, where we had serial samples collected, we saw that the incidence of detecting mutations of clonal hematopoiesis increases over time for these patients while you're on therapy for multiple myeloma. So we started with an incidence or a prevalence of around 10%, and within a median of 3 years of treatment, so pre and post, we saw that at the post treatment time point, the number or the percentage of mutations went up to 25%. So this rise by 15% is definitely a very quick rise in the number of mutations in a very short period of time. So we wouldn't be attributing it to just aging, because as we know, CHIP increases with aging, but just having 3 years pass definitely wouldn't increase CHIP by 15%. So the final message is that we have a new algorithm to fully identify CHIP mutations from germline and tumor mutations. And CHIP in the era of novel agents seems not to have as a drastic effect on the clinical outcomes of myeloma patients compared to the previous treatment era. And the final thing is that while on treatment for myeloma, there seems to be an increase in the incidence of CHIP and the prevalence of CHIP over time. But so far, we are not entirely sure about the long-term outcomes of this. So as more time passes, I guess we'll be able to tell more what would be the long-term consequences of increasing the prevalence of CHIP among myeloma patients who are on treatment.